Thank you to all of you for joining us today. I'm Elysée Nouvet. I'm an associate professor at Western University in Canada and a medical anthropologist. And it's my pleasure to be sharing findings from a qualitative study that the Global Solidarity Health team out of Western University has been leading these past couple of years. You'll also be hearing from Hannah Healey, who you can see on the screen. She is a doctoral candidate at Western University and a qualitative health researcher with over 10 years experience, as well as Mary Ndu, who completed her PhD at Western about a year ago and is now a postdoc at Waterloo University, which is close by in Canada and Ontario. So all three of us wanted to acknowledge that the analysis we'll be presenting is informed by a larger team-based effort. So from May to December 2025, the research team members listed here, many of whom also led interviews on which our analysis is based, worked to identify recurring themes as well as important distinctions in ways those we interviewed talked about solidarity or its absence in global health work. And our presentation today on characteristics of solidarities, as well as a report which will be published on the team website in the next couple of weeks, draws on this team-based analysis. So I just wanted to acknowledge that. There's many people involved. So just very briefly, in terms of the presentation today, I'm going to quickly situate the qualitative study within the broader Global Health Solidarity Project. Then I'll provide an overview of objectives and methods for the meanings and practices of solidarity in and for global health study. We will then, Hannah, Mary, and I share key characteristics of solidarity in participants' accounts and reflections on those. And then we are going to launch into a discussion and take questions in terms of what difference does solidarity make, or any other questions that emerge for you. The project is guided by a strong focus on intercultural learning and critical reflection, and employs pluriversality, an approach that embraces the legitimacy of diverse worldviews, knowledges, and realities, and affirms that divergent viewpoints can coexist in constructive ways. Happy to talk more about our pluriversal approach in the discussion. The main objectives of the project include the following: to develop a more nuanced, actionable interpretation of solidarity that transcends rhetoric, to investigate cultural and regional variations in how solidarity is conceived and enacted, to elevate underrepresented voices and challenge structural exclusions in global health, to establish a tool or index to assess and enhance solidarity practices among global health actors, and to cultivate emerging scholars through intercultural and interdisciplinary engagement. So the meanings and practices of solidarity in and for global health study is a qualitative exploratory study embedded within this larger project. It was designed by the PIs in the Solidarity and Global Health study with the objective of answering the following question: how do diverse global health actors conceptualize, enact commitments to, and recognize solidarity or its absence in the global health ecosystem? And this is in response to a gap in the literature and some frustration shared by many in the global health sector on the word solidarity being widely used, but often seeming to be quite empty in that how it translates into practice, how it's upheld, is inconsistent and even poorly understood. While many have defined solidarity in scholarship and as a core principle for ethical global health action, when we launched this study, there had been no empirical exploration of what solidarity means, involves, or produces in the eyes of those on the front lines of global health programs and organizations. And it is our view that this empirical work is necessary if the concept of solidarity is to retain any relevance for practice and changes to practice in the sector. So attending to firsthand accounts and practice-based meanings of solidarity from diverse global health stakeholders can clarify what is being labeled as solidarity, on what bases, and for what desired outcomes when calls or critiques of solidarity are issued within the sector. And we are also hoping that our findings will inform the development of strategies and tools to support those seeking and committed to rendering actionable and accountable their commitments to addressing global health inequities through solidarity. So to ensure a diversity of perspectives, participants for this qualitative study were recruited from different levels within the global health ecosystem. We recruited civil society organization leaders, so organizations originating and working at the community level, primarily in the global south, but also in the global north when working with marginalized populations, research institutes in the global south, and major global health funding and agenda setting organizations that we are referring to as influencers. And consistent with qualitative research traditions, rather than our sampling strategy was based on seeking contextual variation and depth in terms of the interviews. So we sought balance of genders as well as representation across WHO regions, types of civil society organizations, and we used deductive and inductive team-based analysis to come to agreement on some themes, but also important differences in what we were hearing from these different groups. In total, we conducted 75 interviews, comprising participants from civil society organizations, research institutes, and global health leaders and influencers. Next slide. So a key finding from our team-based analysis of these interviews is that there exists some patterns in the ways in which participants define and recognize solidarity. So this presentation today is taking that series of patterns into focus to discuss and share that with you. We do have a series of articles coming out with a focus on what we heard from participants, particular participant groups. So if you have more pointed questions about what is heard from different groups, we are at a point where we can discuss those. But today we wanted to first share at this earlier point in the analysis what we're hearing in terms of core characteristics of solidarity. And our team has referred to this as core characteristics of solidarity, solidarities with an S quite intentionally, because what emerges in this analysis is that there are patterns, but also what people are calling solidarity sometimes includes references and is associated with different implications for practice and transformation in particular. So participants described solidarity as hinging on shared goals and recognition of interconnected responsibilities within and beyond humans. They talked about solidarity involving action, so definite agreement amongst participants that words or feelings are not sufficient to define what is recognized and felt to be solidarity. And solidarity is transformative. And we're going to dig down into those characteristics with more details now. And I'll hand things over to Hannah Healey to elaborate on the first two characteristics.
Thank you, Dr. Nouvet. So yes, as Elysée mentioned, the first characteristic of solidarity emerging from our analysis was that it hinges on shared goals and the recognition of interconnected responsibilities. And this already begins to answer the question that we're all here to explore today, which is what difference does solidarity actually make? Because the answer, we argue, starts with what people commit to together. And within this first characteristic, participants particularly highlighted two key subthemes, which were the moral foundations of solidarity and also the enactment of solidarity through right actions and relations. Across the interviews, participants consistently framed shared goals as the foundation of solidarity. And solidarity was not described simply as coming together, but rather as involving mutual responsibility and commitment towards collectively agreed upon goals and objectives. So, borrowing one participant's words, solidarity is a mutually accepted and shared responsibility to reach a commonly agreed upon goal. This framing in particular highlights that solidarity is inherently collaborative in the view of participants, but also in a sense structured in that it requires clarity about what is being pursued and who's responsible for what. So participants emphasized that when goals, priorities, and resources were not clearly articulated, ambiguities can emerge, which makes solidaristic action difficult to sustain or translate into meaningful impact. As another participant noted, solidarity is not just about working together, but about aligning priorities, defining contributions, and also establishing roles. Participants reflected on the tensions between terms that they related to solidarity, such as coming together or working together, and they felt that well connected, solidarity was understood as more intentional and responsibility laden than simple collaboration or working together. Yeah, so importantly, even amidst articulating the necessity of shared goals, participants really challenged the assumption that solidarity requires identical perspectives or worldviews. Instead, they described solidarity as possible across difference, where individuals with distinct worldviews remain united through shared objectives and mutual commitments. So, in this sense, solidarity remained pluriversal, but also still contingent upon those shared goals and objectives. As one participant noted, and you can see this on the screen, I don't think having something in common is necessarily a prerequisite because obviously you must share some belief, value, or objective. Otherwise, you wouldn't be acting together. So this matters a lot for our overarching question because if solidarity can function across difference, across divergent worldviews and lived experiences, then its potential reach is actually quite broad. So these shared goals function as the binding forces that stabilize those solidaristic relationships. And it is this stability that enables solidarity to make a difference. So one vivid illustration of solidarity's difference-making potential came from participants reflecting on the power of unity and advocacy work. So solidarity produces results, participants argued, precisely because it brings together diverse stakeholders. For example, governments, international donors, civil society organizations, to collectively pool resources, ideas, and strategies. No single actor can address the full complexity of health systems challenges alone. As one participant noted, some organizations focus on infrastructure, others on policy, others on treatment, and it's solidarity that binds these efforts into something coherent and comprehensive that can function across those categories. And so this understanding was very powerfully captured by a participant from the civil society organization's subgroup who drew on an African saying, a single broomstick is easily broken, but when many are bound together, they form a unit which is difficult to break. It's a simple image, but a profound one as it speaks directly to what solidarity makes possible and isolated efforts cannot. Okay, so participants consistently emphasized that solidarity was not merely a strategy or form of collaboration, but had to be grounded in shared moral commitments. While they acknowledged the challenges of bridging diverse worldviews, their accounts also revealed a striking convergence around certain ethical principles. Solidarity was described as rooted within shared humanity, commitments to reducing suffering, and recognition of interdependence among both human and non human beings. So, across the interviews, participants articulated what we interpreted in our analysis as two core moral imperatives. The first one being that solidarity was framed as carrying a responsibility to reduce suffering and promote health. Standing in solidarity meant more than simple alignment, but rather it implied an obligation to confront marginalization, challenge silencing, and advance collective well being. So here we do start to see solidarity's difference making potential in the sense that it reframes care not as charity, but as shared obligation, and even in some cases, as we see in this quote, a moral call. So, secondly, participants described solidarity as both assuming and affirming our interdependence. For example, one participant noted, disease does not know whether this is a communist government, liberal government, or capitalist government, does it? Death is for everybody, disease is for everybody, everybody is at risk. Many understood solidarity as fundamentally relational and even ecological, extending well beyond human relationships to acknowledge also mutual impact across broader life systems. And together, these findings suggest that solidarity, while plural and contextually shaped, is not value neutral. Instead, it's animated by moral orientations that guide what participants describe as right actions and relations, even across drastic differences. And it's these moral orientations, this sense of shared stakes, that gives solidarity its transformative potential. Beyond simply connecting people together, it also reorients how they understand their responsibilities to one another. So, if shared goals and moral commitments form the foundation of solidarity, then what difference does this actually make? Participants offered a few very compelling answers. And it is precisely the value driven nature of solidarity that ensures its long term viability in the view of participants. When solidarity is rooted in genuine moral commitments as opposed to strategic convenience, it develops a durability that cannot be replicated through siloed or individual approaches. In the view of participants, values are not just what bring people together, they are what keep them together. And participants also spoke to the emotional and moral support that solidarity provides them. Working against systemic injustice and inequity is exhausting, and yet solidarity, in the sense of not struggling alone and being bound to others through shared purpose, can generate the hope needed to carry on and persist. This value drivenness also shapes how solidarity relates to time. So, for many participants, real solidarity involves commitments that outlast any single project or crisis. And CSO leaders in particular emphasize that solidarity must be practiced consistently, not activated in emergencies and dormant in between, but rather as sustained. It's this depth, the moral, relational, and durable nature of solidarity that begins to explain its difference making potential in our view. And as we see in the characteristics that follow, it's what transforms solidarity from sentiment into action. So, moving into the second characteristic, participants identified that solidarity becomes visible through action rather than rhetoric, speaking directly to what differences solidarity can actually make in practice. Participants described a wide spectrum of practices spanning intimate community based and grassroots efforts, all the way to coordinated regional and global advocacy. And solidarity took shape through shared labor, mutual aid, resource mobilization, many examples of how solidarity could take place. And importantly, participants emphasized that solidarity is made meaningful through what people do together. Across both everyday practices and organized interventions, these actions formed what may be understood as a broader ecology of solidaristic action, which is linking local experiences with transnational struggles and individual acts of care with collective moments for change. Participants consistently illustrated solidarity as lived, enacted, and sustained through collective effort and mobilization. And overall, the findings underscore that solidarity is not static or symbolic, but it's relational and maintained through shared practice. And a very interesting recurring theme across the interviews that we did was a very deep skepticism towards solidarity as a mere declaration alone. Participants really pushed back against this, sometimes quite forcefully, against the idea that solidarity is simply an expression of goodwill or shared feeling. And implicitly, this skepticism was about our central question, that what difference does solidarity make? And participants viewed declaration as not making a difference, but action does make a difference to them. So some critiqued a kind of sentimental solidarity, which they characterized as a kind guided by rhetorical gesturing as opposed to commitment and accountability. So participants provided us a practical warning. When solidarity is driven by sentiment rather than capacity and action, the results can be wasted resources or worse, actual harm. One participant, as shown on the slide here, pointed to the pandemic as a striking example of this dynamic playing out at scale. Phrases like, we're all in this together, were everywhere, but for many, they weren't matched by real equity supporting action. Solidarity became rhetorical. And as this participant puts it, when solidarity is declared but not embodied or enacted, it risks becoming an empty word. So, together, these accounts underscore a core tension. Solidarity requires more than alignment and sentiment. It demands action, accountability, and also a willingness to move beyond the comfortable language of togetherness into something that's far more substantive. And ultimately, it's this substantiveness, not the sentiment alone, that determines whether solidarity can make any difference at all in the view of participants. And several participants emphasized that solidarity in action is often inseparable from sacrifice and risk. And perhaps this is where we see the most starkly what solidarity can actually cost, and also in turn what it signals when people decide to choose it anyways. So participants' accounts highlighted the difficult choices faced when working in politically charged or unequal environments. For example, one participant noted, "We face possibly the consequences. We risk our lives together." At the same time, participants described tensions between speaking out and facing serious consequences, such as professional sanctions, loss of livelihood, or legal danger, and how remaining silent to preserve one's position or ability to continue working. And within participants' reflections, solidarity was represented as a form of principled action, but under constraints. So it was not portrayed as cost free, but as requiring a willingness to act, even in the face of risk. And that willingness, participants suggested, is part of what makes solidarity matter so much. One participant offered a striking example of risk, describing the quiet sacrifices made by Indigenous interpreters. So, in this example, despite having access to more stable and secure government employment, many Indigenous interpreters deliberately chose to remain in community based roles. And this decision allowed them to support marginalized communities and challenge discrimination directly. The participant sharing this quote frame these choices as a form of intentional self limitation where individuals prioritize collective well being over personal security and safety. In this sense, sacrifice was understood not necessarily as a loss, but as an active expression of care, agency, and solidarity. These are the kinds of choices that don't necessarily make the headlines, but they're precisely where solidarity's key difference making potential is crystallized, not in declaration, but in deliberate, often costly decisions that people make to remain present with and accountable to each other. Overall, these accounts underscore that solidarity is often enacted through difficult and value laden choices, especially in the context marked by inequality and power imbalance. So, solidarity, as described by participants, is not passive. It does demand something of you, whether that's your time, money, career stability, or in some cases, your physical safety. For many, this willingness to sacrifice was seen as the very essence of solidarity, as proof of genuine commitment to others. For others, it also revealed how fragile solidaristic practices can really be, especially when environments turn hostile. What emerged across the accounts is a kind of dual reality in the sense that solidarity often requires selflessness, but it also requires careful strategy to ensure that that sacrifice doesn't become unsustainable or burn people out entirely. Entailed within this is a readiness to act despite risk. Sometimes that risk involves even imprisonment in the quotes that participants shared with us, and in more extreme cases, even loss of life. That said, we're not arguing that solidarity demands you to be willing to die for it, and we think that that's an important distinction to sit with. Participants described something of a balancing act here, which is that risk and sacrifice remain critical, yet they also echoed sentiments similar to the notion that you have to put your own oxygen mask on first. In order to help others, you have to be positioned to do so yourself. It's a tension that we don't find resolves very neatly, and one that we think very much warrants further exploration. So that brings us to what we think are compelling questions for future work, which is, where is that threshold of risk? How much sacrifice is enough and how much is too much? The conceptualization of a necessary amount of risk, what solidarity realistically requires versus what it ideally demands, feels like a very important area for further investigation. Because until we kind of understand that threshold a little bit more clearly, we're relatively limited in our ability to fully answer the question that's guided our discussion today, which is, what difference does solidarity make, and under what conditions can it sustainably continue to do so? So I'll turn back to Dr. Nouvet now to highlight our third characteristic.
Thank you so much, Hannah. So moving on to characteristic three, this was a recurring theme in participants' accounts of solidarity, which is that solidarity is transformative. Participants credited solidarity with achievements of such things as safer healthcare and systems, improved community infrastructure, more sustainable livelihoods, more inclusive digital access. And transformations associated with solidarity include, therefore, many things that were about improved living conditions, but they also extended beyond the material. Solidarity impacted on ways of working within organizations. They transformed power relations, and it brought about what participants described as important policy and process reforms. The following quote from one participant, a civil society organization leader, captures one account of solidarity described as improving lives, in this case of rural women, by increasing their agricultural productivity and economic autonomy. Before our intervention, about 50 women shared small plots and transported water long distances to irrigate them. We trained those open to changing their practices, offering access to water and land for organic production. This experience was transformative, reducing their workload, increasing income, and proving that organic autonomous production was possible. Some paid school tuition from their earnings and brought home produce that changed perceptions in their households. These are real lived experiences that show how collective effort can change lives. Along with solidarity's power being associated with such tangible outcomes, some participants cited improved accountability processes or more inclusive governance structures as examples of solidarity's transformative powers. This quote is from a community leader in Canada talking about solidarity being at the root of new processes and policies for ensuring stated commitments to work for women with disabilities translated into money spent on that population. So they did an audit of themselves to see how well they had done on spending for women with disabilities, and they were really disappointed in themselves when they found that they hadn't done well at all and made a commitment at our policy forum. And I've actually written it into the policy language in the department so that the funding would actually reflect commitments that were stated to this particular group. Solidarity was not only about achieving results, whether in process or in material outcomes. Participants described solidarity as changing how people related, listened, and worked together. Solidarity transformed the doing of global health work, in other words. Many participants provided in their accounts of solidarity in action descriptions of stepping back and making space for others who had historically been excluded from decision-making to be at the center of those decisions, and leadership. Solidarity was associated with non-hierarchical, respectful, and reciprocal ways of working that redistributed power, actively worked to reduce privilege, and increase capacity for local leadership. Participants described these relational shifts as fundamental to what solidarity produces and how it makes a difference within global health work. Different participants described solidarity as guiding and leading to changes in the distribution of power in their organization in various ways. One researcher, for example, talked about their research institute and partner organizations thinking about solidarity as removing barriers to action across roles and disciplines, not only in terms of going against a hierarchical model for one that is more horizontal, but also thinking in terms of an ecosystem. So we're trying to break the siloed view of science. No one is in charge of an ecosystem, it just functions. Next slide. For another participant, to do solidarity in global health meant being attentive to the ways organizational norms, however inadvertently, often reinforce the privilege for some or limited participation. One change this participant had brought through in their organization and associated with solidarity involved putting an end to expectations of unpaid work from community youth that failed to recognize free time as a luxury for this population. So you can see from this quote, asking people to volunteer is a luxury. You can't ask people with limited access to resources to volunteer their time. It's crazy. Volunteerism is literally a form of privilege, and you are asking people to wield privilege that they don't have. So we found a tiny little pot of money. It was gift cards. It wasn't even cash that we could give them, but we were at least able to give them gift cards for their time. It was small but meaningful. What we heard in our interviews is that solidarity not only is the key to goals of transformed living conditions becoming a reality, but solidarity also involves relational shifts that make such achievements possible. Listening, fostering spaces, redistribution of power were all cited as concrete expressions of transformed solidarity. In this view, transformation is not only an outcome, but also integral to solidarity and action process, one that reconfigures relationships, amplifies marginalized voices, and restructures the conditions that produce inequity in the first place. That said, Within the way people talked about the ethical and practical differences enacting solidarity could achieve, there emerged important differences in what they were saying can and should change. Participants associated and expected different outcomes from solidarity in global health, in other words. All participants called for increased power for Global South actors over priority setting and strategies to address challenges, but the extent of power sharing and what they were calling power sharing did vary. So we heard things such as the following. My understanding of solidarity and the principles I'm referring to include giving those directly affected by the problem an opportunity to be part of developing the solution. This means creating spaces for them to come together and collaborate. It's a more cooperative approach compared to working for someone, which tends to be hierarchical. I'm specifically referring to working with local communities and organizations, as well as working through them. Working through them involves utilizing mobilized resources to ensure they are managed effectively, including financial and technical resources. This participant, and I mean, this is the sort of statement I think many of us hear in our spaces in terms of what constitutes better and transformed practice. This participant values less hierarchical ways of working. They call for more cooperative approaches. They believe in them, but also express through their words is a norm, whether desirable or not, that the Global North funders ultimately control the possibility of there being more equitable approaches. It is, in this case, this is somebody working in a large organization, and it's their organization, a big funder, that gives or can give affected populations opportunities, that can create spaces, that can create collaboration, and retains that power. For another participant, this normal control over how global health work is done by certain organizations, usually based in the global north, need not remain the norm. So they say almost all of our structures in global health and development is undervaluing and underfunding the contributions of Global South partners. We don't even question the imbalance of resources that are available for Global North organizations versus those from the South. It's just nuts. We just accept it as a principle, and in fact, it does not have to be that way. And it certainly doesn't have to be as glaring as it is now. So Solidarity's relationship to the status quo differed across participants, including across those we interviewed working in major global health funding. Next slide. I'm handing things over now to Mary.
Across all characteristics, solidarity emerges as a living principle. Shared goals ground it, actions activates it, and transformation sustains it. In this sense, solidarity operates simultaneously as both a process and an outcome. It reshapes systems while it's also transforming the individuals and institutions that partake in it. What differs across all the actors is not their commitment to solidarity, but their perspective and positionality within the global health landscape. The model presented on the slide helps to illustrate this dynamic. It positions solidarity as a layered and evolving process. At its foundation lies the recognition of shared goals and interdependence. Participants across all groups emphasized that solidarity begins with the understanding that health challenges, social inequities, and global health crises are not isolated problems. They are interconnected issues that requires collective responses. So purpose or shared goals therefore becomes the moral and relational anchor of the solidaristic engagement. So ultimately, this slide, the model is suggesting that solidarity should not be interpreted as a passive alliance or a symbolic declaration of shared values. Rather, it represents an ongoing collective movement. So it connects both the moral and practical engagement and long-term transformation. Thank you.
Okay, so we're coming to an end. I'm gonna summarize a little. So we have identified these three characteristics amongst many kind of associations of the word solidarity. Our goal with this project was not to generate a concise definition of solidarity. It's an exploratory study designed to advance empirical understanding of what solidarity is, requires, and can do in global health. And by gathering and digging into examples of solidaristic practices shared with us by diverse global health actors, we've been able to identify these core characteristics, which are really ways of talking about and identifying whether solidarity is present or not in given partnership or collaboration, as well as explaining why it matters in global health. And while identification of these ways of thinking about solidarity brings some clarity to a concept that's often invoked without accompanying definition, what's also clear in our analysis is that different stakeholders associate and expect different things from solidarity. And this is particularly apparent as participants speak of solidaristic action and outcomes. For some, solidarity is evident when more space is made to consult and include organizations with historically less voice in decision and policy-making processes. It's about listening, but it's not. But for others, it really has to be about challenging who controls the space, the time, the invitation, and the outcomes of such collaboration. So another key kind of takeaway is that solidarity is what it achieves and how people get there. We can't separate the method and how or relationships at the core of solidarity from its what. So next steps. We are finalizing our analysis and write-up of findings. As mentioned, we already have a report on views on what a tool might provide that's available on the project website. So please, at the end, have a look at that. The characteristics report will be up in a couple of weeks. And then we're putting out several publications based on the different participant groups and what we heard from them. We are bringing these findings into dialogue with other learning from literature reviews, regional workshops, and ongoing discussions within and beyond the team. A dialogue like the ones that have been going on through our webinars have also been really helpful to our analysis. And our project goal has been to develop some kind of tool or index to assess and enhance solidarity practices. So that's also in future steps, which of course requires answering like what are the expectations of solidarity that we want to see centered and informing such a tool. So I'm going to leave things there. I thank you to all study participants, of course, for sharing your perspectives, and to regional workshop participants, the team, and to all of you for attending. And I hope there are some questions.
Excellent. Thank you very much, Elysée and Hannah and Mary online. I think this is quite a lot of work that's gone into this, and the findings are certainly quite rich. I think they help us all to get closer to an understanding of what solidarity is and what solidarity can do. I see there are already some questions coming up in the chat. If people have other questions, feel free to sort of raise your hand and then we'll call on you. But I just want to start off, Elysée and Hannah, by reading some of the questions that we've received on the chat, if you'd like to speak to them.
Sure.
One is from Karen Daniels, and I think in the intro, she says she's from Cape Town, right, from South Africa. And the question is, the one thing that I've heard coming from the data is that solidarity is inherently political. And I mean, as in based on one's ideology. You spoke of being intentional, of it being intentional, but the intention can be a political or ideological one. Can you speak to that? And I think the next question by Melanie Katsivo, if I'm pronouncing that correctly, said the interviewees comment on the role of politicians and government officials in either supporting or creating barriers. How do they deal with this? So maybe we can try to take those two questions together.
Yeah, thank you. Those are really excellent and important questions. And yes, there there is kind of an overarching understanding that comes out of participants' perspectives on the need for change to the conditions that are causing health inequities being addressed. And of course, that involves policy changes or changes in the structural and systemic distribution of power, resources, control over those factors which are leading to conditions causing inequities. So there's definitely yes, an ethical and a political, for many it is political in the sense that it's a critique of structural and systemic inequities and an identification as those needing to change. At the same time, and as noted, particularly with respect to characteristic 3, but also hinted at in what we were talking about in terms of risk and sacrifice, there's quite a spectrum of, in terms of the degree of disruption, if any, that participants were proposing are needed. So I think that, it's difficult to kind of align it with a particular ideology or even level of change, because we did hear a lot of different things being called solidarity or being seen as transformative for that matter. In terms of, government involvement, we didn't have specific questions about government involvement, but we did hear quite a few people talk about COVID and talk about the way in which, without binding obligations or binding commitments from government, we're not going to have those kinds of changes that we need. So there remains concern shared by us as co-investigators as well when we are talking about like a voluntary solidarity, which is kind of what the pandemic treaty is putting forth. This project is kind of centered around the tensions between how do you have a global solidarity, right? When that does involve nevertheless respecting different governments and communities' ways of operating. I don't know if that gets to your, if
Yeah,
that
thanks.
satisfies you.
Thanks. I think,
Huge questions.
these are pretty heavy and large questions that we could have a long discussion on. Let me just read a couple of questions so that
Sure.
we can try to speak to them. One is a very short question, but it's quite a long one. Says, how does one assess success or progress in terms of solidarity? Maybe we'll leave that to
Uh,
Hannah. Hannah, you start thinking of an answer and we'll come back to you on that one.
Okay.
Okay. And then the other question from Ansfal Singh is, I wanted to ask if solidarity is pluriversal. How do we avoid reproducing systemic hierarchies when building a tool or index to measure it?
okay.
Elysée, shall we
I'll
go
start with
first?
that one and
Yes.
then we can see.
And Hannah, you come in on the other question. Yes, yeah.
All right. Thank you for that question, Anshpal. And indeed, so we have some elaboration on that in our protocol paper in BMJ Open. But one of the things is that, first of all, in our move towards this index or tool, we have been working in a way that is avoiding a single universal definition or ontology of solidarity. So that's in accordance with a pluriversal approach that recognizes multiple coexisting ways of knowing and relating. And we're also, as a team, resisting a norm in academic work, and that's quite tricky, which is the norm of translating what we learn into existing academic and Western frameworks. So on the one hand, we have to situate our findings within Western frameworks, and at the same time, there's a tension there in terms of allowing, if we hear things that are outside those frameworks, letting them have their space to be heard. Our intention is to design a tool or tools that continue to resist standardized definitions. And we've talked about having a tool that's flexible, that prioritizes and supports certain types of relationships described in the presentation today that are attentive to power and positionality, and that are going to leave space for context-specific usages. That's as far as we've gotten so far. We're moving into the design phase for the next couple of years. It is going to be a process, but it's a really great question. Thank you.
Great. Hannah?
Yeah, so I feel like the answer is similar to Dr. Nouvet's, but one thing that I did want to kind of highlight as well is that like the strategy that we used to sample in this case was specifically focusing on gathering diverse views. Um, and also, as we saw the characteristics kind of coming out, we noticed that they were coming out across very different worldviews. So kind of the findings that we've presented are reflective of a lot of different perspectives, but also at the same time, we're not trying to suggest that these are the only characteristics of solidarity that exists. And we very much want to frame this as an open conversation.
Yeah, absolutely. Great. We have some 3 or 4 minutes for the next set of questions. So I'm going to try and just throw out the ideas and we'll see whether we can speak to them quickly. One is a question from Sepo. Says, drawing on an African relational ethic, Ubuntu, the project argues that solidarity is inherently connected. Solidarity is not just helping the other, but recognizing the flourishing of one community is essential to others. I think this is more of a contribution and a comment. Then
Yeah.
from Niaz Ahmed, just to know your opinion, is there any opinion overview or from participants for social accountability, governance, and advocacy point of view with regard to solidarity? And finally, so you can pick, I mean, just these questions and maybe say something quite brief. I'm sure you won't be able to address them totally. And there's a question here in French. I'll see whether I can translate it into English. So talking about NGOs, not in the Sahel, that work in agriculture, nutrition, and other. And can they be integrated into the global health solidarity, context in order, to avoid, multiple crises that face the populations? This is from Hamidou in Mali. So basically the integration of local NGOs that are perhaps not working directly in health, but in other similar areas that have an effect on health. There are more questions coming. I don't think
Yeah,
we'll be able
great.
to read all of them. Do you want to say something on these, and then we'll look at the last set here.
Okay.
Yeah.
Yeah, these are great questions.
Mhm.
I'll start with Mr. Diabra's question.
Mhm.
Um, I guess not everybody has translation. I would answer in French, but I'm not sure if that will work. So, but yeah, I mean, in terms of how we approached and are approaching the exploration and surfacing of different conceptions of solidarity, the ONG in the Sahel, like IMSD, would certainly be considered a global health related civil society organization. And the way in which participants spoke about solidarity at all levels, including big funders in offices in the global north. There's definitely a recognition of the centrality and, in fact, the necessity of solidarity being something that is coming from and responding to needs that are understood by populations who are facing challenges directly in their environments. So there's no yeah, that's definitely a key part of how our team is conceptualizing global health solidarity as something that's very much cross-cutting at different levels. And it's institutionalized in many ways, including in the civil society organizations. And sometimes it's not institutionalized and it's being practiced at the community level outside more formal pathways. But all of that is kind of contributing to that interconnectedness. Nia's Yeah, opinion overview, social accountability, governance, and advocacy regards to solidarity. I mean, I think that solidarity in terms of the one of the core characteristics that's coming across in the interviews, there is it's not named social accountability by participants, but this sense of responsibility to one another as humans and even beyond humans is does kind of have some adjacent meaning to this concept of social accountability, potentially. But the degree to which people then talked about it in relation to global health governance and intergovernmental organizations, for example, and their role, or large funders or large philanthropic organizations, really varied a lot. So I wouldn't say that there's kind of a consensus on that, or and it is interesting that social accountability was not a term used by participants. So thanks for drawing our attention to that.
Great. There are still some more questions, and I mean, they're very important questions. For example, somebody asking us, a SEPO asking about how we can translate global public's vocal solidarity with people, for example, in the Middle East, into enforceable institutional accountability. And also how, proponents of solidarity can sometimes be the privileged who are trying to stand with other people. And
Yes,
I mean, these are things that we are actually discussing as a team. And
yes,
when we talk about tools, what we do, and also about the question of hierarchy, is that our tools will be multiple tools so that people from different positionalities can use them to hold each other accountable. So it's not
yeah.
only one tool that is going to be standing outside. Even if you're a powerful organization, you will be held accountable by the less powerful. And that way, hopefully, we can try at least to, create a more balanced way of engaging when we're working for a common cause. But
Mhm.
I'm sure we just have 2 minutes left. I just want to say thank you. This has been very rich, and this is, I mean, of course, today I mean, you just presented the work, but I mean, I just want to say I know that a lot of work went into this. Many people spent hours and hours working on this, and it's been very good.